So once again, we thank you for joining us here for the Rural FASD Speaker Series. We are absolutely thrilled to be joined by Dr. Tony DeBono of Access MHA and Michelle Miller, also of Access MHA. This is a really new and exciting project that's just came into existence, as I understand it, really just in the past year. I know that there had been lots of groundwork that had been going on for years before that, but this has basically came into existence in this past year. And it's really about making sure that everyone in our local rural areas has rapid access to mental health support. And so they're going to be sharing this really new, exciting model. That is, my understanding is, I don't think it exists anywhere else in Canada right now. I think it's just here. So we are obviously thrilled to be joined by them. But before we begin, we of course want to acknowledge that we are on the traditional and unceded territories of the Algonquin people. And we thank them for the opportunity to be able to use this land to work, play, and pray. And so with that, I will turn it over to Tony and Michelle to introduce themselves.
Wonderful. Thank you so much, Rob. It is a pleasure for Tony and I to be here with all of you this morning. A quick introduction. So I am Michelle Miller, the Operations Manager for Access MHA for the East Region. We have Dr. Tony DeBono with us, who is currently in the role of our clinical lead, training lead, and data and evaluation lead on the project. So Tony and I are here with you this morning to share with you Access MHA. So Access MHA is the regional coordinated access for mental health, substance use health, and addiction services. So let's get started. Today we have a couple of objectives that we would like to share with you. So we're going to provide an overview of the Access MHA model, demonstrate how Access MHA works, and describe how Access MHA is making a difference for clients and families. So why are we here? We need to improve the client experience and what happens to clients in the mental health system. So why Access MHA? Because it's way too difficult to access the mental health and substance use health and addiction system. We know that the system is very complex and uncoordinated, and clients are waiting way too long to access services. What we also know is that there are many gaps in service, often leaving hospital emergency departments as the default to access services. We know that current staffing models, levels, and geographic distribution are not aligned with client needs. We also know that the client user experience is not standardized, leading to challenges in common system-wide data collection and monitoring. So what is Access MHA? Access MHA is a bilingual, digitally enabled service model designed to make it easier for people in need of mental health, substance use health, and addiction support to access the services they need when they need them. We have a 5-step process, which is 1, clients identify a need for help. 2, Access MHA provides clients with a single door into the system, no matter where they live or what they need. 3, clients are assessed using standardized evidence-based intake processes and tools. 4, clients are then matched to the best service and continue to receive support if they need to wait. 5, clients receive the mental health, substance use health, and addiction services that they need on the spot when they need them. Access MHA provides service match pathways to mental health services, substance use health services, addiction services, and peer-based services. And most importantly, for all levels of need, when you need them, at any point throughout our service. Access MHA was developed using a number of core components. One of the most important aspects and components of Access MHA is that the model was developed with people with lived and living expertise. When we look at our core components, we look at basic information and crisis supports, linkages to primary care, geographically distributed community-based physical sites, standardized service matching using stepped care, different levels of screening and assessment and triage, supportive transfers to specialized access pathways, supports while waiting for services and re-entry pathways, collection and use of standardized data, focus on health equity, feedback from service provider and to referral source to really close those communication gaps that are absolutely essential in providing clients the support they need and continued support that they need, and a multimodal access enabled by technology. When we look at this graphic, this is super exciting for us to be able to share with you all today. This graphic was just released yesterday, where Tony and I were absolutely honored to be at the Community Addictions Peer Support Association Festival, which was working on wellness to really look at physical health, mental health, spiritual health, all of the ways in which wellness is included in all of our lives. This graphic really shows the model of Access MHA, where we need to include all voices, collaborate and co-design, and improvements from feedback. We look at improving better outcomes for care, deeply and respectfully listening to people with lived experience. We know that not a one-size-fits approach works for everyone. We explore, we learn, and we grow, and we work in partnership to inform and shape care. We optimize, we engage, and we implement. How we got here. A collaborative co-design, client-driven approach within and beyond the Champlain region over 4+ years. If we look back to October of 2018, this is where the Access model was developed. We then started to plan implementation in the Champlain region in August 2019 to August 2020. In October 2020 to March 2021, we launched Access MHA in the Champlain region. If we look at where we are right now, we currently have received approval from Ontario Health to optimize and expand and begin implementing in other regions of Eastern Ontario. We continuously have new partners to join us on our Access MHA journey of where we can send referrals for clients. Just to name a few, within our current partners are Families for Addiction Recovery, Hawkesbury Hospital, the Distress Center, the Community Mental Health Association, CAPSA, the Royal, Psychiatric Survivors of Ottawa, the Ottawa Hospital, Montfort Renaissance, Connect Well, Valoris, just to name a few. And we continuously have new partners to join us on our journey every day. Over to Tony.
Thanks so much, Michelle, and thanks so much, folks, for having us here today. So let's dive into how Access MHA actually works. What's the experience like for clients and families? And let's start with a video that we actually have posted on the landing page of our website on AccessMHA.ca. So let's flip it over there for a quick video there. Michelle, next slide, please.
Do you or a loved one need help with mental health, substance use, or addiction? Access MHA is a single portal through which residents of Eastern Ontario who are 16 years of age and older can access mental health, substance use, and addiction support when they need it. The healthcare system can be complex, confusing, and overwhelming. Access MHA provides a clearer path and simplifies access to mental health and addictions care for everyone. Just fill out a simple form at AccessMHA.ca to book a confidential phone call with a mental health and addictions professional. You'll be connected to services that will meet your needs. All services are funded by the Province of Ontario, and there's no cost to you. If you are concerned about your mental health, substance use or addiction, or that of a loved one, go to AccessMHA.ca.
All right, well said,
You are a
Access
loved one
MHA
with help with
website. Let's flip over to the
You
next
are a lo-
slide there, Michelle. Thank you so much. So the idea behind Access MHA, which to Michelle's point, really is informed by folks with lived and living expertise. So this idea of how do we create a more simplified system or take the guesswork out of getting you from the point where you are requesting services to the point where you're actually connected to services. So our concept is one starting point, one referral, one assessment process. And we really want to simplify to make it quite the easy process. And we're going to be showing a demo in a moment. But the idea is you go on our website, AccessMHA.ca. You're going to be booking your appointments immediately there for an intake call. And you get an intake call usually within about 24 to 48 hours. And I'll be able to explain in a little bit more detail what that process looks like. So Michelle, next slide, please. All right. So what we also are really proud of is the fact that oftentimes a key partner in a family's care is their primary care provider or family physician. And we know partnerships with our family providers are so key to make sure that clients and families get the best care journey possible. So what we've done is we've made it easier for primary care providers to make referrals. So we use like special computer systems so that referrals can go directly from doctors to us. Again, taking that legwork out of the equation for clients and families. So that way it really streamlines the process. And on our leadership committees and in terms of advisement, we really are also getting some important information from our primary care providers about how to make it the best experience possible for clients and families. Next slide, please, Michelle. All right, so this is a busy slide, but what I'm going to do is I'm going to walk you from A to Z. So it starts off on the left-hand side with the referral. Now on the left-hand side here, we're going to show that you can either go online and self-refer on AccessMHA.ca and answer a few questions to get yourself started and to book your screening appointment. Or you'll see the second bubble underneath where primary care provider can actually make a referral to Access MHA through their own computer system. It's called Ocean, just as an FYI. Once the appointment is booked, what will happen is you will receive some questionnaires through a secured link that's secured from a privacy perspective. And the reason why we send those questionnaires is we want to get a little bit more information about you to help serve you immediately once you call. So we'll ask questions in a standardized way to look at things like your mental health and how your mental health or substance use health could be impacting your day-to-day life. Then what will happen is within about 24 to 48 hours, you will get a phone call from one of our screeners at a time that you select. And in the language of your choice, in English or French, what will happen is we will ask a few quick questions and get you set up to the service really that best meets your needs based on that whole assessment of information that we've collected about you. What's really important, if you go to kind of closer to this green bubble here on the far right where it says service match or service navigation, what that means is we take the opportunity to either match you directly and make that referral directly to a service provider to get you started with your treatment. Sometimes what we do is we offer some resources and navigate you to that service, again, taking some of that legwork out. What's really important is that at every call, clients and families are offered peer support from our direct peer support folks within Access MHA, but also we have a growing list of client, family, and peer support resources on our website that we're expanding daily. So we make sure that all of our clients and families are informed of the website and those resources at their fingertips. Next slide, please, Michelle. All right, this is the fun part. So here's the demo. So Michelle is clicking this demo link, and what that link is the AccessMHA.ca website. So what it's going to do is it's going on the World Wide Web. And what you'll see here is you type in your address. Thank you, Michelle. She's going to type in here an address there. Now, important to note, our screeners, the great talent that work with us at Access MHA, they work Monday to Friday. However, we're here on a Saturday and you can still go at any time, 24/7 to our website. But as you can see, even though we open our doors again for the week on Monday morning, you can get yourself an appointment as early as Tuesday morning at 8:30. So let's click there, Michelle. Thank you. So on the right-hand side of the screen, what you see, your appointment is at 8:30 Eastern Standard Time, and it's going to be 30 minutes long. So you already know. The appointment's going to be by phone call. You also know that our talent and information specialist, Jordan Carzoli, is going to be the professional calling you. And Jordan provides services in either English or French, your choice. From there, what would happen is, if Michelle clicks continue, what we do is we'll ask a few questions about your mental health, substance use health, in terms of your preferences for what types of help you would like to get. So we ask a few questions ahead of time, and then you get an email reminder and you get an email notification to sort of have all of the information available for you after the fact, and you have a phone call within that time frame. So you'll get today we would have gotten a phone call Tuesday, September 20th, 8:30 a.m. Next slide, please, Michelle. All right, so, yeah.
And I think back over to me quickly, and then over to you again, Tony. So really our next objective that we want to go over with you all is how Access MHA is making a difference for clients and families. So we know after our first year and a half of launching that we have improved access to services. We know that there's fast and easy multimodal access, so instant access to resources and to the first appointment. Clients can book first appointment within 24 to 48 hours. Range of self-referral options. So currently it's online, but as we continue to expand, we will have a 1-800 number. We do hope to have those drop-in appointments available. So at some of the organizations that I discussed earlier, as some of our partner sites, we're hoping at some point as we continue to expand that there will be that drop-in option to get that initial screening appointment on the spot when needed. And then as well, as we continue to expand, we're looking at a chat text option to also help clients get connected to service. We also have the primary care e-referral integrated with EMRs, which will be coming as well within our optimization. So that really looks at another barrier being reduced for our primary care providers within the community to really have another less step that they have to complete in order to get that referral to the appropriate services. We also, look at that stepped care model. So matching to the most effective, least resource intensive service using gold standard processes means more clients can be served within the system. And then we look at coordinated care. So clients are always at the right door. Clients are never too well or too ill to access services. Clients don't need to know what's wrong. They just need to be concerned about their health and coordinated pathways to outreach services. If we look at our first 17 months of operations, we have served just over 11,000 clients, and we have 27,000 direct contacts with clients. Most clients reported problems in multiple areas, and almost half of clients who were surveyed reported that if Access MHA wasn't available, they would not have accessed the appropriate level of care. If we look right now in terms of our total service matches, 67.6% of clients have been service matched. 20% of our clients have been navigated to services. So this could be potentially, currently if a client was to seek our services that are not within our current catchment areas in the Champlain region, we would make sure that we would not be dropping the phone call with this client, and that we would be providing them services and navigation to a front door in their area for them to connect to services. 13% of our clients have received peer support, and we have already identified that 9.1% of clients who have come through Access MHA is a service gap in which we were not able to provide potentially the most appropriate level of service that they required, but we still potentially match them to a service to still receive support in some capacity. Over to you, Tony.
Thanks, Michelle. What I'm really proud of is the way in which we're developing the Access MHA model in partnership with clients and families and with providers as well. So the concept of system and service integration is really trying to take a lot of these sorts of separate or distinct systems and making them integrated. So what that really means is that for the client and family experience, it's smooth, it's well coordinated, while we take care of that legwork in the background, so that way folks don't have to worry about a lot of those sorts of things. But also this idea of concurrent, meaning there could be a few things going on. So mental health needs, substance use health needs, and other types of needs as well. Comprehensive, we're really trying to build on the fact that mental health services sometimes appear a certain way, but actually there's lots of different types of services that are going to be important in a person's life, all the way from individual services through to things like crisis services, hospital, and perhaps things like housing. And of course, making sure that we're aligned by values, by the needs of regions and the needs of our province to make sure we're all in the right direction. Next slide, please, Michelle. And importantly, there is a real focus and commitment from the Access MHA team on health equity. This idea that folks are getting the right services for them, for their needs, no matter who they are. So our Access MHA commitment really is around equity and breaking down systemic barriers to access. So we really are doing this from a place of humility and joining with folks and folks from different communities to learn and to see how we can best evolve our program to ensure that everyone's needs are met. We're also actively working on ensuring that our services are meeting all standards to ensure that whether or not you prefer to have your service in English or in French, you'll be able to get those services. And of course, making sure that regardless of where you live in terms of in a big city or out in the country, that you're getting great access to services. So in the first 17 months of operation, we're serving 18% of clients that identified as being from a minoritized or marginalized group, and 17% identifying as having a disability and or accessibility requirement. Next slide, please. And really this idea of evidence-based. So what is the evidence and the different types of evidence that we use? So these really important scientific concepts. So we have scientists as part of our group that really advise us around how do we do the right thing based on the science? How do we do things in a way that's standard across so that we have a good idea of the data that we collect? And then always taking the stance that we're growing, learning, and changing. And we do that through things called performance measurement and evaluation, as well as this idea of continuous quality improvement. What that means is we take feedback from clients, from families. We have an advisory group. We take feedback from clients and families through a questionnaire process as well. And we're always trying to improve the quality of our services. Next slide, please, Michelle. Here's an example of how we've done that based on client feedback. So here's an example of an automatic pathway to this really innovative idea called the digital front door of the Rapid Access to Addiction Medicine Clinics. It's called RAM. Very important for folks who have substance use health needs, particularly around alcohol or opioid use. So the idea here is if I put in my information into the self-referral, just like we showed you, depending on how I answer those questions and what my substance use health needs are, there will be an automatic pop-up and a direct link to get you to that digital front door. So you didn't even have to think about that. You just answered specific questions, and we were able to develop a computer way of detecting that the REM digital front door is probably a really important need that you might want to consider. And then what we do to make sure that nothing falls through the cracks, our team contacts this REM service as well to ensure that the referral is not lost and that you're connected to the right service at the right time. Next slide, please, Michelle. Okay, so what does it all mean? Well, we are on a journey, folks. So we know that really this is just one of many starting points of us continuing to grow and evolve, but we want to provide equitable access, and knowing that health equity is a really important principle of ours. We want to continue to improve the client and family journey. We want to continue to make it easier for clients and families by Access MHA having great partnerships with family doctors, nurse practitioners, people who provide what we call primary care. We also want to make it easy for those same doctors and nurse practitioners to contact us. And of course, ultimately, we want to make sure that we're using the information that we collect to better serve our clients and families in the future. Over to you, Michelle.
Wonderful. Thanks, Tony. So want to get started or learn more? You can always visit us on our website at www.AccessMHA.ca, or we also have our inquiries at AccessMHA.ca email, where you can send direct questions or comments back to us. That does get answered by myself and Tony on a regular basis to really implement that feedback into our current everyday processes, as well as to share feedback and ideas back to potentially service providers or users of our system. We welcome anyone to contact us through that, and we will share that with all of you as well after the presentation. That concludes our presentation. We thank you all for giving us this opportunity to be here today and to present to all of you, and really looking forward to future discussions and coming to a neighborhood near you, hopefully very soon, with our services. So thank you, everyone.
Thank you so much for this, Michelle and Tony. We are, I had an inkling of what the presentation was going to be about, but I was not prepared for the quality and just how amazing this program really is. So when I was listening and watching some of the slides, a couple things that came to mind for me was, number one, we know from research that 90% of individuals with FASD have mental health challenges. And when we also think, though, about the fact that 70 to 80% of them are also going to have communication challenges, there's going to be accessibility challenges, there's literacy challenges that go along with that, that concept of accessibility becomes really a really difficult one. And to look at how you have really came up with a model that supports those individuals and enables them to still access your service, I think is a wonderful lesson that I think a lot of different organizations, including ourselves, can learn from. The very fact that you're using computer algorithms to determine when someone, in terms of the type of need that they have, when they likely can't even communicate that themselves, is that in itself is just cutting edge and completely amazing. So again, I also want to just share with you very quickly that we've actually been joined here in our studio audience by Bill McPherson, who is actually our local school trustee for the Upper Canada District School Board. He also sits on our Special Education Advisory Committee. And I would not be surprised at all to hear that there could very well be some further conversations that happen along with that. So I can also tell you that Shannon Russell from Kids Inclusive our FASD worker is also here. So this is absolutely wonderful. Thank you for taking the time. And so to our audience, we once again want to thank you for spending this half an hour with us, and would let you know that we've already got our next speaker lined up at this point. We are anticipating in October that we're actually going to be joined by our local Access MHA provider, ConnectWell, and the team from there. So we'll be able to extend this even to I guess the next steps after folks have got connected with them. So again, thank you very much. And at this point, we will see folks next month.